Good day. It is my pleasure to welcome you to today's webinar, Building Patient Trust Through Accreditation and Certification for Medical Travel Programs. I'm Karen Timmons, Chief Executive Officer of Global Healthcare Accreditation and formerly served as CEO of Joint Commission International. Joining me today are Dr. B.K. Rana, the founding Chief Executive Officer of Quality and Accreditation Institute of India, as well as the CEO of NABH, formerly. Mr. Bill Cook, who is the Director of Business Development and Marketing at Global Healthcare Accreditation. Next slide. Today is an exciting day and one that I have looked forward to with much enthusiasm as we are announcing and launching a collaboration between our two respective organizations. GHA and the Quality and Accreditation Institute have launched a joint accreditation program for hospitals and clinics in India which serve medical travel patients. The goal of the partnership is to leverage each other's strengths to better serve providers as well as patients in India seeking to enhance the medical travel patient experience as well as business performance. GHA is the only accrediting body that focuses exclusively on medical travel standards. Our professional norms were developed in consultation with international experts in the medical travel industry, and we really focus on helping organizations improve the patient experience for patients who travel, and we support healthcare providers in validating their quality, increasing their visibility, and implementing sustainable business models for medical travel. Our services include accreditation, certification, training, and advisory services for hospitals, ambulatory centers, hotels, and individuals. Our standards have been internationally recognized by the International Society for Quality, which is really the accreditor of accreditors worldwide, and most national or international accreditation organizations strive to have their standards recognized by this body. The next slide, please. And Dr. B.K. Rana will be talking about the Quality and Accreditation Institute of India.
Thank you, Karen, and good morning, good afternoon, good evening, ladies and gentlemen. It's really a great day for QI and GHA on the occasion of launch of this webinar for bringing out a very international specific accreditation program for medical value travel. And briefly about QI, QI was set up to create an ecosystem of education, training, and quality improvement and accreditation. QI believes that this organization would provide a platform for stakeholders, including professionals and organizations associated with quality, to share their wisdom and knowledge to make their vision be realized. Over the past 3 years, QI has developed 8 sets of accreditation standards. Many of these standards are first of its kind in India. QI receives SQA's International Society for Quality in Healthcare External Evaluation Association accreditation in 2019 for its dialysis standards, in 2020 for home healthcare standards, making it a very specific and unique accreditation body here in India, having 2 sets of standards accredited by SQA IEA. Next slide, please. The joint accreditation overview talks about how 2 organizations comes together in facilitating the quality improvement and patient safety for medical value travelers. So GHI and QI will work together, which will focus more on how the care can be delivered for medical value travel in a manner that they remain safe at all the times. And this program is clinically based on a very strong foundation of quality improvement in patient care, which is led through already accredited hospitals, whether it's QAI or NABH and JCI. And the joint accreditation survey by both GHA and QI surveyors would have surveyors from both of the organizations complementing each other for clinical as well as medical travel value component. QI will also serve as GHA's local partner here in India, and we will conducting joint trainings, workshops, and advisory services, and also provide information about GHI accreditation and related programs. We have been developing different relationships, and this relationship, which focus more on medical value travel, will bring couple of other programs as you will see today as we moving forward. So thank you very much joining us here, and we would look forward to your continuous support in making our hospitals in India a global hub for medical tourism patients. Thank you.
Thank you, BK. And the next slide, Bill. Before we get into it, I think as BK has referenced, we are really excited about having a local partner in India who understands the healthcare system, understands the healthcare governance as far as the regulatory bodies. And so it really enriches, I think, both of our organizations. And I just want to really tell you how pleased we are to be working in India with QAI, and the experience that Dr. BK Rana brings to the table in accreditation is very, very important. So we'll be talking about, our relationship throughout the presentation, and we will be taking questions at the end of the session. So if you do have any, please don't hesitate to jot them down, and we will respond at the end of the webinar. So for our purposes, medical travel is defined as the process of traveling outside one's local area of residence for the purpose of receiving medical services. In some countries, that might be traveling from a different state across the country to another state as part of a narrow network. But for the purpose of this conversation, I think most of us realize that many patients travel outside of the country for medical travel, and there's different drivers as to why they might do that. Certainly from my country in the United States, patients might be looking for more cost savings because healthcare is very expensive. So they're looking to go to countries that provide a lower cost for healthcare. Others might be looking for quicker access, such as patients from Canada or the UK, where even though they have a national healthcare system, it might be 2 or 3 years before they're able to obtain the appropriate treatment or procedure that they need. Availability, being able to have treatments that might not be available within their country. There might be different rules or regulations that prohibit that procedure or treatment being treated, and they want the latest, or it might be higher quality that they're looking for. Certainly in today's world, with the rise in middle class and Africa, China, we're seeing many more people who are traveling, many for very different motivations, as we talk about. And as they make that decision as to why and where they are traveling, the perception of destination becomes very important, as well as the safety of the country. And all of these add up to value. So they're looking for value, they're looking for an experience, and we will be talking about that as we go through the slides. Certainly around the world, there's aging population in many, many countries, which brings with that more chronic disease. Dentistry is usually not covered as part of insurance or payment of healthcare services if it's a national system. So people might be looking for lower cost for dentistry. Increase in degenerative diseases. They're looking for higher quality options, more innovative technology that might be available. The growth of the middle class in less developed countries certainly drives the ability to pay for different choices with respect to care and treatments. And people are very comfortable with traveling. Prior to the past year, certainly there was a very much an ease of travel and a very well-formed infrastructure around the globe with respect to airplanes, ports, et cetera, being available. With the advent of the iPhone 11 years ago, there's certainly much more access to information, digitized communication in mobile phones, web browsers, social media, online sharing. So the patient is really becoming much more informed about options. They want to be part of that decision. And what it has also transformed is the patient experience, because now they're used to getting information immediately, and they expect that information from hospitals and healthcare services as well. There's global healthcare shortages in some countries that is driving medical travel, and certainly more ease of income, and instability in the home region also will drive patients to travel outside of their country. An interesting aspect of medical travel is that there are different stakeholders than one might expect. Certainly, when you're in a traditional hospital or clinic, you deal with stakeholders like through the Ministry of Health and your local regulators. With medical travel, you certainly have a coming together of tourism, different supporting sectors that might be travel, the hospital, government is heavily involved, not only in the Ministry of Health, excuse me, but Ministry of Tourism. There might be economic development. There might be those who are giving visas for medical travel. And I know in India, certainly you have led the way in issuing a medical visa. So there's very different sectors that are involved and have a stake in the success of medical travel. Patients are also looking for entities that have more than one good hospital. They want to see research, education, a multitude of organizations that are offering differentiated services. So it's very important that they see a robust infrastructure of healthcare within that country or destination that they're going to. If you look at what we might call financial capitals of the world, such as New York or London, or the high-tech areas, and certainly India shares that, as well as Silicon Valley, there's a cluster of organizations that help promote that identity as you're part of the financial center or an IT center. And the same thing with medical travel. Patients like to see a building of a cluster of well-known organizations and institutions. Hotels, tourism, travel, local businesses, restaurants are very dependent on medical travel, and it certainly reaps an economic advantage to them when they are affiliated with hospitals. And certainly payers, insurers, employers, and government are heavily involved, and patients from all over the world, as well as facilitators, might be involved with medical travel. So it's a very diverse stakeholder group and a very important one as well. And it's important that they all work together. Now in India, this is pre-COVID. In 2015, the number of foreign tourists that arrived in India were 234,000 in 2016, increased up to 428,000 in 2017, and almost 500,000 in 2017 per the Ministry of Home Affairs. So we know that India is very much a leading and well-known destination for medical travel around the globe. And BK, maybe you would like to also comment on your perception and experience with medical travel in India.
Thanks, Karen. Yes, I think these figures are quite encouraging to Indian hospitals and Indian economy, including governmental setups, as the medical travelers is increasing year by year. And I think currently also the current government is very much, a focus on how they can build a very sustainable model or ecosystem for medical travelers who are coming to India, because it's a matter of not just of the quality and safety for patient, but also of the stake of the reputation of the country. And as we know that India is being known as a hub for medical tourism destination, so it's become more important for our government to looking at. And I think I'm aware of that. Currently, the government is really serious about it. And in just last week, a webinar, the event organized by the Government of India, the Ministry of Commerce, this was the center of talk, how we can build a system where medical travelers feel confident from the day they start their journey from their own hometown, and they visit India, get the medical treatment, their post-operative care, and then going back to their own country. So I think whole point-to-point coverage of care and clinical and non-clinical aspect of a medical traveler are very essential. And I'm sure with this program, many hospitals would find it of very great value, and we will definitely see a increasing number of medical travelers coming to India. Thank you. Over to you, Karen.
Thank you. Next slide. So what are the key elements for success in a medical travel program? Certainly, Government support is imperative, and it does seem, as BK has mentioned, that there is strong government support in India. Important partnerships between the public and the private. Tourism planning, obviously, as I mentioned, the Ministry of Health, but the Ministry of Tourism is also should be very active and knowledgeable about medical travel because of the impact that it has really on the ecosystem in the area where medical travel is occurring. Human resources training, new skills might be needed as far as language capabilities, as far as understanding what the medical travel patient is looking for and how to provide a good patient experience. So many times there's a need for human resources training, and patients are looking for validation that the organization is up to par with respect to treating medical travel patients and is practicing at the international standard level. So accreditation and certification becomes very important as patients are looking before they travel for those organizations that have undergone a voluntary validation of their services. And certainly marketing and promotion is especially important, making sure that how does a hospital or a destination, and many times you can work together, or it could be the cluster of hospitals that I mentioned or clinics might work together to enhance websites, to enhance knowledge about a certain location as a destination, as well as an individual hospital or clinic. And it's part of our job to make sure that what that hospital is promoting has integrity and is accurate as well. The next slide. Now, these statistics are from certainly prior to 2020, but the pre-COVID projections were very, very positive for medical travel, calling for a 25% increase each year for the next 10 years, reaching almost 100 billion worldwide in revenue by 2025. And also as part of that, because as I mentioned, patients have become much more knowledgeable about options that might be available, they really are demanding more data in making decisions about care. And they're also looking at the patient experience. They expect good care and they expect a good patient experience. And buyers of healthcare services, insurance companies, employers, governments, are also increasingly focused on the patient experience. We at GHA have some insurance companies on our board, and they have said that this area, as far as patient experience, is the area that they see the most complaints about, where patients have good outcomes, but something has gone wrong in that patient experience, whether it's transparency with respect to billing or lack of access to a translator, and the language experience is not that optimal. So there are things that can happen that really we need to focus on. And we're going to be talking about not just the medical care, but the entire continuum of care that a medical travel patient experiences. And we call that the medical travel care continuum. And we will be talking about that throughout the presentation. So this, and you can go on to the next slide, Bill. So certainly this past year has transformed life around the globe as we know it. Obviously, we have all learned to adjust. It's hard to believe that it's almost been a full year now that we've been in lockdown and a new normal, where healthcare provision, travel, the economy, and social norms have changed drastically in the blink of an eye. And for medical travel programs, their models have been significantly impacted, not only because of travel restrictions, but sometimes they've had to shift their bed capacity and provided for obviously the care of patients who are local who require care due to COVID. So medical travels in particular have been hit, and but most industries have also been hit very hard. Next slide. Healthcare providers who have had to cancel their elective procedures in order to obtain greater bed capacity or mitigate the spread of the virus. A few programs are starting to open up. It's my understanding that India is one of those who are opening up. But there are certainly, periods we've all seen where there might be a quarantine, there might be a shutdown for a small period of time and then a reopening. So one has to be very current on the knowledge of what's going on in each country. And certainly for patients who are traveling, it's very important that they understand the potential options that are available for them and how to stay safe as they're doing that. And others have been shut down, certainly at times, who focus exclusively on the medical travel market. So while the situation in many parts of the world continues to be uncertain, some regions and countries are reopening, and certainly now that the vaccine is available, we are definitely seeing the availability and the potential of a new normal. And medical travel programs are rethinking their strategies and taking deliberate steps for sustainable recovery now for that new normal. We do know that patients across the world have been waiting for treatments and procedures that have been they have been unable to receive. So we know that there's a pent-up demand. And so it's very likely that as things settle down in this new normal, that the programs will open up and there's a potential to really receive a good number of patients because of that pent-up demand. As we do that, and I've always thought of accreditation as a risk reduction activity. As you move to the new normal in medical travel, it's really that ability to deal with a crisis is largely dependent upon the structure, policies, and protocols that have been developed before the chaos of the unexpected. So it's very important, and I think accreditation or certification provides access to those protocols, those policies that you're thinking about prior to an emergency happening that really do sustain medical travel programs for the long run. Safety is likely to become very much a brand differentiator as we move forward. Research in the past 6 months has really shown that brand loyalty will likely hinge on safety above all else, a factor consumers certainly are prioritizing well into the recovery and beyond. And this was a survey that was done by US Travel and Transportation. But I think that's not a surprise to hear that the patients, consumers, citizens all over will be looking for safety for their family, for themselves. Consumers are seeking trusted sources. This one, who do you find to be the leading authority on what defines safety when it comes to traveling in the context of COVID-19? It could be the World Health Organization, CDC, the national CDC of countries, state government, et cetera. And consumers are also putting their faith in brands they trust, and they are likely equating brand trust also with cleanliness and sanitation as well. Consumers want evidence of safety protocols. So this question, when planning to book your next flight or hotel, please rank the following factors based on importance to you once social distancing recommendations are lifted. So for airlines, it was brand trust in that airline, including confidence and safety and cleanliness of the aircraft. That was higher than what the price is. Hotels, brand trust, including confidence and safety and cleanliness. Again, the highest over price. And when we talk about safety protocols, we're talking about, what is the staff been trained to do in order to protect the guest, the patient, and I say the guest for hotels, the patient for hospitals. How do you protect your own staff? How do you protect visitors who are coming in, clients who might be coming into an organization? So safety protocols are very important, as well as obviously cleaning protocols. They want some attestation that that organization that they're going to for a treatment or a procedure is following safety protocols throughout that entire continuum of care. And that begins with planning from their home base, travel, stay at a hotel, stay at a hospital. So a hospital that's treating patients has to worry about the hotel that they're referring patients to stay, because they want to make sure that they're safe within that hotel as well. Next slide. Now we're going to talk about our program in building patient trust and accreditation and certification. Now, there have been many studies over the years about the impact of accreditation, and certainly the opinion and the findings of those research studies do show that there's a positive impact on the quality of healthcare services when an organization is accredited. And again, I take it back to that slide on, mitigating risk, because accreditation forces you to look at your processes and mitigate risk of something wrong happening, an error happening. GHA is different from other accrediting bodies because we do focus on the medical travel patient. We do not go into the quality and patient safety infrastructure. The clinical accreditation will take care of those things, and we do instead a deep dive with respect to the medical travel program. Now, so we require an organization to be accredited by either their national, such as NABH, or an international accreditor prior to becoming GHA accredited, because we want to focus on that medical travel program. We want to look at that entire care continuum, and we're not redundant with the standards that an organization might have met when they had their clinical accreditation. We're focused on the needs of medical travelers and international patients. We want to make sure that we are a strategic partner with an organization. We care about an organization's bottom line. We want to see that grow following GHA accreditation with respect to medical travelers. We are supported by a diverse group of stakeholders on our board. We have insurers, we have providers, we have patient experience folks such as Plaintree who sits on our board. And we work very hard to provide organization with increased visibility opportunities in order to raise the brand awareness of those organizations. You might say, well, why is there a need for medical travel accreditation? And I'm going to talk first about the solution, the medical travel care continuum. As I mentioned, I think of a patient sitting at their kitchen table, possibly looking for, options with respect to which country should I go to, which hospital or clinic should I go to, and that's the service selection, destination selection. So they're looking at a lot of factors. They're looking at websites. They're looking at information about that cluster. How prominent is medical travel or expertise within that country or city that they're planning on going to. And once they have selected an organization, they start sharing information with that organization, and they want to have good service. They want to make sure that that they're treated confidentially. So we want to make sure that all of their records are protected. There's confidentiality, obviously, with healthcare records. So how is that organization protecting those records? And there's planning for the treatment, and the hospital is assessing the patient, wanting to make sure that they're the right patient for the right treatment at the right time. And then there's all the complex arrangements and planning the itinerary, the travel, where they're staying. They would go to an accommodation. So all of these things GHA has standards about with respect to sharing and being transparent about information. Now, the next three circles, admission, treatment, and discharge, those are the traditional areas that a clinical accreditor would look at. And we also look at those areas, but we're looking at it from the perspective of a medical travel patient. So we're looking at the pre-arrival and post-discharge care management. We're looking to make sure that there has been transparency and compliance. Obviously, many countries have different legal structures, and so it's important that a patient understand what legal accountability might be available in that country, what is the policy with respect to consent. So there's many factors that might be different from their home country, and a good medical travel program will be meeting the international standards with respect to transparency and information being provided. Obviously, things such as financial transactions. Many times an organization might have what we call a bundle, a flat fee, a total fee for the service, which is very good. So a patient understands, what they have to pay. But if they might not understand that if there's a complication, that there might be an add-on charge. So we look at all of those areas. We also look at marketing practices. And I had mentioned before integrity, but we also are looking at their marketing practices in order to provide insight and advice and guidance as to how they might better target countries that they want to attract patients from. How are they localizing their websites to different target countries? What avenues are they choosing for marketing, social media? We look at their supply chain. We want to make sure that medical devices are not being held up in customs, but that they're there when the patient arrives. We certainly look at the patient experience, communication, education, patient advocacy, and travel and tourism services. So we are different than a clinical accreditor. We do that deep dive in medical travel. And it's been interesting to me when we've spoken to some of the leading hospitals around the globe with respect to medical travel. And this one was Bumrungrad, a large hospital in Thailand that receives more than 50% of its, at the time had received more than 50% of its revenues from medical travel patients. He said, and they had many different accreditations or certifications because they were trying to attract patients from different countries. So they were obtaining seals that those patients would recognize. And he said, not one has ever stepped into our global patient services unit. And so I as a CEO, want to make sure that the organization is practicing international best practices, that we are as efficient and as effective as we can be. So it's just a perspective that many times the medical travel unit or the global patient services unit might not be as well integrated into the organization as when a clinical accreditation occurs. So we do look at the deep dive in the medical travel area. Our value, we certainly seek to provide value to patients, enhancing that patient experience. That medical travel care continuum that we displayed, we want to optimize all of those touch points. We want to mitigate any risk along those touch points, and those are the things that we're doing during the survey process that really impacts the patient experience. So things like pre-arrival, admission, post-discharge, both in and outside the clinical setting. We work to really help providers. We want to understand the business strategy. We ask, in fact, for the medical travel unit within a hospital to provide their business plan as one of the things as an introduction during the survey. We want to help them improve their operational excellence and metrics to improve the delivery of services, patient experience, and bottom line performance. And it's very interesting and important to note that research has demonstrated that organizations that have better patient experience scores correlate with better outcomes and financial performance as well. And we certainly want to raise the awareness of GHA accredited organizations to potential buyers, to insurers, to networks who are looking for more ease with respect of patient experience as well as quality, because these organizations have both clinical accreditation as well as medical travel accreditation. And now I am going to ask Bill Cook to present the rest of the presentation on our standards and best practices. Bill?
Thank you, Karen. Thank you, Dr. BK. So I'll go in a little bit into some detail into some of our standards and some best practices, as well as the joint accreditation program and some of our other programs. And I think it'll be provide value, especially to organizations, hospitals, or clinics who are serving or thinking of serving medical travel patients. And one thing just to mention, I know Karen, I think mentioned it at the beginning, but if you do have questions, there is a Q&A section there. You should be able to see it on some of your screen there, that you can actually type in your question there. So at the end, we can answer any questions you might have. So just going a little bit into the GHA standards. So our competency areas, we do focus on three main areas. They're patient-focused clinical processes, as you can see there. And under that, you can see the chapters that go under that: care management, infection prevention control, quality improvement, patient safety, patient rights. So that number next to those are the standards, and each of those standards have 4 measurable elements associated to those, but that's going into a lot of detail. But we are, as Karen has mentioned, we are different, from a clinical accreditor such as, in terms of JCI, or in terms of our medical travel standards, QAI, and others. And even though we do look at some of the clinical areas, they're always from the perspective of a medical travel patient. For example, infection prevention and control, we were looking at what is the organization, what is your hospital or clinic doing to mitigate the risk of a patient coming from another country with an infection, or leaving your hospital or your country to going back to another country, which is obviously very relevant right now with COVID. But we always do look at these things from the international or the medical travel patient perspective. The next competency area is patient experience. That's obviously one of our key focuses. Cultural competency, communication, and education. And we'll go in a little bit of detail on some of these in the next couple slides. Patient advocacy, look at the physical environment, travel and tourism, and then also sustainable business processes, which I think is something unique in terms of a accrediting body, looking at leadership, risk management, business ethics, financial transactions, marketing. They're really working with organizations to address their bottom line as well. Supply chain management, Karen had mentioned. So just quickly back, and Karen went over this, I won't spend a lot of time on this, but this is the medical travel care continuum, the different stages that typically a medical travel patient may go through as they're looking for healthcare services in other destinations or other regions. So we are going to go in, in the next few slides, just some of these stages that you see here, that service destination selection. I'm not going to go through all of them because it would take quite a while, but just to give you some examples of our standards and best practices. This is an example from looking at that stage, service and destination selection, really looking at, during this stage, here it notes kind of the goal is to provide patients with access to detailed information on the website or other marketing channels, social media, to provide education about the organization, about your services, the destination, and professionals. So you really have to think, if you're a hospital or clinic, what is the first impression patients have when they arrive at your website? Are they finding the information they're looking for? Is it in the language, their chosen language? Is it easy to contact people? So remember, you have to keep in mind, I've seen that oftentimes patients are looking a lot of times at multiple hospitals. They're looking at, for a procedure or treatment, but they're oftentimes weighing different hospitals. So the more relevant information you have on there, the better. These are some marketing one. Standard one is one of our marketing standards, and some of the measurable elements or best practices that you can see under there. So the medical travel program or designated department plans the key policies and processes of its marketing program. It talks website language understood by target market groups, cultural considerations appropriate to target market. As Karen mentioned, localization, that's really localizing the content on your website to your target market, looking at colors, symbols, content, images that really aligned with the cultural background of the patients you are targeting. So there's evidence that website localization improves the user experience, really aligned with the patient experience. It can there's been some studies that can produce increase in customers in terms of patients. Cultural sensitivity, I think it enhances the sites. There's also evidence in websites usability. So that's an important aspect. Mentioned contact methods and staff information available and as well on the website. Patient advocacy, that's one of our standards, 3.4. Opinion and satisfaction data when used in marketing materials or on the program website are validated and approved for use. So do you have something validating the information the patients are saying or sending to you, or do you have the patient's permission to put that information or the testimonial or the video on your website? Marketing 2 here, the medical travel, the marketing media and materials of the medical travel program are accurate and transparent. So in our standards, we really talk about, really the common thread is transparency, that supporting data is available online or by request. And maybe they're looking for information by your physicians, or credentials available. Can they request those? Can they view those? Pricing information is accurate and substantiated. Appropriate disclosures around pricing. So really focusing on on transparency here. And again, these are just some examples, standard, quite a few standards, go into a lot of different details, and it's important part as well as the standardization. You may be doing some things or a lot of things well in your medical travel program, but is it a standardized process that you have in place? Going to another stage there, information sharing and planning. Here, kind of the goal is to provide timely and relevant information to educate, inform, and build trust. Gather from the provider's perspective, it's to gather information needed to ensure the individual is a good candidate for the procedure or treatment. So here's some care management one. This is one of our clinical, patient-focused clinical standards. The medical travel program has a standardized process for the collection of patient clinical data and information and reports prior to patient travel or on arrival. Whether you're using checklists or other standardized what are you using to collect that information? Somebody who's reviewing that information, is a process confidential? The way you're collecting, are you just using an email, or the patient sending you emails, or do you have a secure portal to request that gather that information? The information is informed on any additional required documents, tests, results, or other clinical information needed by the medical travel program, prior to the patient's arrival. Inform any related physical and or healthcare requirements associated with the plan, procedure, and treatment. Right now, I know with COVID, a lot of countries have different requirements. Some require insurance, some require a test prior to travel. Need to inform the patient about quarantine and different things. So it's important to have a very clear and standardized process in place. Another example, care management 8. Here talks about patient medications are tracked and reconciled across the medical travel care continuum. And I think medical reconciliation with medical travel patients can be tricky sometimes. Medications, for example, can be prohibited in their destination or in the destination they're traveling to. Maybe they're traveling with a medication that's not allowed. It's a controlled substance in India or another destination, or maybe even they're going in transit through another country that may have that medication may be prohibited in something, whatever reason, they have to stay overnight. Their plane has an issue, and then what happens then? Names of medications may be different in the patient's home country. There may be limitations on the amount of medications the patient can bring in. Medication may not be available in the patient's home country, or generic versions may be prohibited. So there's a lot of things to be aware of, with patients in terms of the medication part. And here, I won't read through all of these, but here are some of the things recommended in the GHA standards. Continuing with information and sharing, here's another looking at now at communication and education, which is obviously a key element with medical travel. You want patients to be aware before they travel of their plan of care, what's going to be going on in the destination, and all the details so there are no surprises, their expectations are met. So communication and education 3, one of our standards medical travel program, educates patients regarding the planned care at the destination, really what's going to happen A to Z if possible. Some cases patients may not know, but they're going to get a diagnosis in your hospital or clinic, but in a lot of cases it's a pre-planned procedure, so you can provide very detailed information to the patient. So and here again, some of our best practices from our standards medical travel program provides education to prospective patients about the anticipated care plan and the facilities where the procedure treatment will be provided. Increased risk of combining travel with surgical procedures, obviously that's very important. Educating the patient or communicating total length of stay in country, providing a detailed itinerary. I know we're working with a hospital in the past through their accreditation process, and they were, normally you would send a very detailed care plan itinerary to the patient, but they were also working with a number of facilitators, and they were providing, the facilitator was communicating directly with the patient, and these hospitals were providing the facilitators with the care plan and assuming the facilitator was providing this to the patients. But during the accreditation process, it was discovered that actually many of the facilitators were not providing the patients with the care plan, or not all the information that the hospital was providing. So that was kind of, the hospital was surprised about that and had to follow it up with a lot of the facilitators. They put a plan in place to really communicate with them, ensuring that this was a clear requirement that the care plan and details that were that they were sharing with the facilitator would be provided to the patient. So, and again, just another example about the importance of communication and education. Communication and education 4, there on the right there, the medical travel program educates patients about the processes in which they will participate in. So patients are educated about the infection prevention and control program. Obviously, is very important now in this time. In terms of hand washing and their companions, social distancing, PPE, mask use and things like that. While they're at the facility, it's very important for them to know in advance, and once they arrive, to be educated about that. Patients are educated about the quality improvement, the medical travel program's quality improvement and patient safety program, and how they expected to participate. You may ask, what would that be? One example would be patient identification. If you're in a hospital, if you're a patient, oftentimes you may, one nurse may ask you for your name and your date of birth, and a little while later, another nurse or physician may ask you for your name and date of birth. And the patient may just a little bit later, the next day, be asked for the name. And the patient may wonder, why is everybody asking my name? And don't they remember who I am? But it's important to let them know why the organization is doing that. It's obviously for the patient's safety, and in terms of ensuring they understand that. Talking about informed consent beforehand, so they understand what they will. Understanding the consent, obviously, informed consent is a process, not just a form, and so having the organization communicate that to the patient before they arrive, and so they're aware of what they must sign once they get there. Having patients educated about diet, medications, and other factors. For example, many medications, aspirin, or things they may need to stop taking before they travel. Looking at arrival and accommodation, and again, these are just some selected examples we took from our standards. Travel and tourism is part of our patient experience competency, and really want to ensure that the recommended transportation, accommodation options are aligned with the patient's companion needs and expectations. So travel and tourism, the medical travel program helps facilitate a satisfactory travel experience to the destination and on the return home. I found, and speaking with organizations, speaking to patients, travel, I think, is a big part of the medical. Obviously, it's a key component of medical travel. Patients are traveling for procedure, but there's travel involved. Now it's even more stressful with everything going on, but it's always, can be a stressful experience with going through airports, security checks, and things like that. So it can be very stressful for the patient, and it is a very important part of the patient experience. I remember speaking to a physician once who had a patient for, I think it was an aesthetic procedure, and the procedure had come out very well. The physician, felt the patient was very happy with the procedure, and this physician working at a hospital would always send out a satisfaction survey online afterwards, and he received the result, and normally I think it was a 5, was like excellent, and he received a 3. And so he was very surprised. Why would I get a 3? I thought the patient was very happy with the procedure. But then when he spoke to the patient, and talked to her, I think it was a woman he spoke to, she talked about, well, the hotel, nobody picked me up at the airport, or the pickup was late. Hotel was really not understand my needs, and a lot of issues there. So a lot of issues outside the healthcare environment that impacted the patient, and ultimately that patient's perception of their experience wasn't as good as it could have been because of the travel component. So it's important to manage that as well. Here's talks about some of the in terms of our standards. The patients receive a treatment schedule, a care plan, so they can facilitate informed judgment in making their travel arrangements. Process to inform the patient about any unique travel arrangements and recommendations in regards to their specific needs. Alerts patients to legal requirements to travel, whether it's visa, whether right now with the COVID vaccine, or tests or vaccines they may need, and things like that. It's very important for the patient to be aware of those in advance. And again, you may be doing some of these things. It's important to be doing them have a very clear policies, so all staff are doing it all the time. So it's standardizing that process. Travel and Tourism 4 is one more example here. The medical travel program assists patients in selecting appropriate accommodations at the destination, and Karen, I think, alluded or mentioned that earlier. And so it's important that the organization understands, has visited these accommodations, and not all different patients have different needs. They may have different budgets, maybe have different conditions. Somebody coming for a dental treatment or maybe a minor aesthetic procedure potentially could stay at any hotel, while somebody coming for a knee or hip replacement may need a hotel that a different type of hotel. And staff, if they are receiving medical travel patients, hotel staff, it's important they understand the needs of these patients, who need to contact if there's an emergency. So it's important to visit those hotels, make sure they have the different amenities and service, cultural, dietary, religious, handicapped access, and things like that. So just moving forward here a little bit into just an overview, high-level overview of the accreditation process, GHA, and with the joint accreditation with QAI. Typically, an organization will fill out an online needs assessment that's on our website. We oftentimes may have a call as well and a discussion. If the organization decides to move forward, there's a proposal that's executed. GHA standards and materials are sent to the organization. Survey dates are confirmed. As we mentioned earlier, GHA's the survey would include a QAI surveyor. So GHA would have a medical travel surveyor, and QAI would be the clinical surveyor. And pre-survey activities we are doing at this time, because of the pandemic, we started in August of last year a remote survey process. So it's worked very well. We've actually accredited now several organizations through this remote survey. So there are pre-survey activities that are initiated prior to the survey, ensuring technologies is aligned and works well, and a few other things. So that's something that's scheduled. Then the accreditation survey, which we're doing remotely at this time, and then the accreditation report and decision is provided afterwards. So that's just kind of a high level process so you understand. Here, just a little bit more details. It is a 3-year accreditation for medical travel services. We mentioned earlier about the ISQA and the 3 main competencies. Eligibility criteria, it's important for our organization to be accredited by GHA. Since we are focused, as Karen mentioned earlier, really a deep dive in the medical travel program, it's important that the organization already have a national or international accreditation, such as QAI, NABH, ACI, and also a formal medical travel program or international department. Typically, we've seen in terms of preparation, it's between 3 and 5 months. Some have been a little bit earlier and some a little longer, depending on the resources and what stage they are. Length of surveys, normally for hospital, it's 3 days, for ambulatory center, 2 days. And with the remote survey, because potential time differences with the surveyors, we may shorten the survey days, but make add additional day. So that's something we may be doing. And I mentioned about the surveyors. In terms of cost of accreditation, is typically between $20,000 and $25,000 for hospital, and there's an annual $3,000 annual renewal fee, and for ambulatory centers, $16,000 to $18,000 approximately, but for organizations. Now, just moving into some additional services provided by GHA. There's a certification for excellence in medical travel patient experience, and this is a certification for hospitals or clinics who do not have that accreditation, clinical accreditation. So they do not have that, and that's something we can focus on, primarily the patient experience and the business side, so sustainable business processes. So it is based on the same standards, but we're just not looking in depth at the clinical standards. And this can be an option for an organization to be certified. And if they do get a clinical accreditation later on, we can do another short survey with a clinical surveyor to moving up the GHA accreditations. So this is also a 3-year certification. The cost is depending on the size of the organization, but it is less than the accreditation cost. So it is, as you see on the right there, is focused on these 3 areas: pre-arrival communication, education, care, treatment experiences, and post-treatment and follow-up. We do also offer custom education and advisory services. Some organizations have requested standards and survey process training prior to the accreditation, kind of help them fast track to the accreditation survey. This can also be done online. gap assessment or mock survey focused on the GHA standards, providing a very detailed report to help them move forward with accreditation. And a medical travel program development. If a hospital or clinic does not have an international office medical travel program, or they want to strengthen their program, can help and work with organizations on that as well. Certified medical travel professionals. So this is an individual certification. All these other programs I've talked about are for organizations. This is for individuals. So it is an 8-hour online certification, really focused on bringing people up to speed. People who are maybe already working in the industry or just new to the industry, just to understand best practices, looking at just business models of medical travel, focused on patient experience, looking at marketing, risk mitigation. So it looks a lot of different areas, and it's something that can be done quickly. 8-hour training. There's an online exam. Individuals do have access to online educational resources, and also it will be showcased on a business directory. This can be for physicians. We've seen healthcare management executives, staff working in an international patient department, facilitators, travel agents. So it's a wide range of individuals. We've seen interest from this certification. Certification of conformance. So this is a certification we issued in, I think it was July of this past year, certification of conformance with GHA COVID-19 guidelines for medical travel programs. We did receive, talking to some of our accredited providers and other organizations that really saw the need for a seal to help build trust in our organization, that it has the protocols in place to mitigate risks for the patient during travel and treatment. This is not a certification in terms of how to treat COVID patients, but how to mitigate risk, operational protocols, practices, and procedures while the patient is traveling. So there are guidelines that we were developed, and these are on our website. It can be downloaded for free. And then there's a certification that's also that I mentioned, that it's part of the organizations, hospitals, or clinics with medical travel programs can achieve. And it's a relatively it's a quick process. Usually we've seen really more about 3 to 8 weeks. Most organizations who've been certified, it's mostly an online process. So something you would apply.
I don't know. I think Bill has paused. So let me, I'll jump in right here. The certification of conformance it is online, totally online process, where in organization we have detailed required documents that are necessary for each phase. Some relate to how a patient should comply with airline protocol, what they should do to keep safe, the hotel protocol, as well as the hospital protocol. So,
hello, can you hear me?
Oh, yes, now.
Okay, yeah, I just an issue. I apologize. My internet went out the second, it came back on, but so I'll get these back to the current slide here. So the certification conformance, I was talking about that. So it is a short process. Online organizations, they would submit evidence of compliance. We review that information. They would submit that to a portal, and then we would have a valid call at the end. And
Bill, I'm sorry, Bill.
Yes.
I'm not able to see the slides. Is it me only? Or?
Oh, let me see. Maybe I have to share again. Let me check on that.
Share your screen.
Yeah, I might have lost that in a second. Yeah, thanks for letting me know.
Yeah, up. Thanks.
See now. Okay,
yep.
Great. So, and in the pricing, we really try to price it low, understanding current circumstances. So it's under $2,000 for hospital and $1,250 for an ambulatory center. So this certification, really the feedback we've had from organizations, and we've had quite a few in right now. I think right now about 12 or 13 roughly that are several that are in the process of going through this certification, and it has been a benefit for these organizations going through the process, ensuring they have the protocols. You're looking at the hotels, the patient protocols, and I'll go through some of these protocols here. Here again, it goes through kind of the continuum, what we talked about talked about earlier. So just to give you some examples of.
I think Bill's having trouble again. So there are guidelines with specific safety protocols at each phase. So the patient will know and they will receive, here's what you should do when you're in the airport, here's what you should do when you're on the plane, making sure they have sufficient PPE equipment, that there's a protocol for the driver who picks up the patient at the airport, a protocol for the hotel, so that that whole issue of safety that we mentioned earlier in the presentation, how important that is to the patient, that is certainly part of this discussion. Bill, are you back on now?
Yeah, yes.
I think you could go to the next one because I kind of talked about the safety protocols.
Okay. Can you see the slides, or just want to make sure?
I can see the slides. Is everyone able to see the slides? BK, can you see the slides?
Yes, Karen. Yeah, Bill, go ahead, please.
Okay. Yeah, so I guess you talked about that service and destination selection. I mean, testing policies, this communication that the organization is providing to the patient in advance, so they're aware of workforce safety strategies, travel restrictions, quarantine, the use of personal protection equipment, patient visitor companion guidelines, sanitation and cleaning. So just ensuring that there is communication with patients on that. Phase 2, we're looking at the medical travel program provides a detailed, one of the I guess elements, a detailed itinerary care plan that that also includes impact of COVID on length of stay, what travel warnings or restrictions for the destination because of COVID, in terms of vaccines and different things the patient might need, insurance, protocols to mitigate COVID-19 risks. So that's looking at the information sharing, arrival, and I'm not going to go through all of them, just to mention a few.
Yeah, Bill, I did go through some of these.
Okay, so okay.
Move to the next.
Okay, so thank you. So that was just to give it a little overview of what the certification of conformance looks through, and what we're looking at. Just to give you a little bit detail on our accredited and certified clients. These are some of the examples. You see some well-known organizations here, such as Cleveland Clinic, Cedars-Sinai. It was recently accredited actually with a remote survey. Bubbengrad, Karen had mentioned, and a number of very well-known organizations. Prince Sultan Cardiac Center in Saudi Arabia. We have an academic medical center, Seoul National University, and Bandung in Korea, and in different countries, Croatia, Greece, Thailand, Mexico, United States. So a number of organizations have been accredited, as well as now we've got a number have achieved that COVID-19 certification of conformance. So here's just quickly highlighting a value of accreditation we have seen, and this is Prince Sultan Cardiac Center in Saudi Arabia during a conference we were at, and we weren't aware of this. They were presenting, and they talked about they had been accredited several months prior to the conference, and they started talking about how the accreditation had changed, what changes had happened. Here they kind of mentioned processes redesigned to adopt special needs of traveling patients and their families, and social service assessment, admission and discharge forms, satisfaction surveys, hospital websites, modified KPIs, different things. But they talked about how those things were modified, and then they was surprised to us. Well, not that we did. It was we didn't know about this, like I mentioned previously, but they do the Press-Ganey survey, that satisfaction survey in Saudi Arabia that's required, and after achieving GHA accreditation, they were ranked first and second, first in outpatient and second in inpatient service, respectively. And also their medical travel program had increased significantly. So they did start with a low volume, but it was we were very great, impressed to see these results. So that was one example of a client who's achieved GHA accreditation. These are just some collaborations, and we've got many more now. Recently, we've been working a lot on collaborations. Obviously, a key one now with QAI, our accredited organizations that provide accreditation services. But these are Saudi Anaya, an insurance company in Saudi Arabia. They were at a conference and introduced to GHA, and they were really impressed with the GHA program and signed an agreement with them, and they reached out to our hospitals in terms of potentially sending some of their members these hospitals. Custom placement assurance. This is an organization that provides a medical complication insurance for patients, and it's something that hospitals can use. They can embed it in their medical travel in their packages, or just have the patient purchase it. And also, because of this agreement, they do have they get a discount through our partnership. And GBAC, we've not talked about this, but this is a organization with a hotel accreditation term. They're the Global Biorisk Advisory Council, so it's the Well Hotel program. Just finalize here a few testimonials from some of our clients: Cleveland Clinic, Bummengrad, St. Catherine's, and a few others here, talking about the value of GHA. And to finalize, at least for my part, and Karen or BK may have offered any comments, but really I think our value, and especially now with the cooperation, our collaboration with QAI, we really want to enhance that patient experience across that entire medical travel care continuum, what we talked about, those touch points, with the expertise, the clinical side from QAI and our medical travel expertise, ensuring patients have that, an outstanding experience on all those touch points, improve the performance and effectiveness of the medical travel program, also, their business processes that we talked about, work with organizations, hospitals and clinics in terms of your visibility, adding you to the family of GHA accredited providers, inviting you to conferences, different things we work with organizations to help and increase the visibility. And finally, and I think we talked at the beginning about the importance of accreditation, really is a third-party validation. You may talk about how good your services are, you may be doing a lot of things well, but having someone else come from outside and really validate that, I think is something very important for patients and payers. So thank you, Karen.
Thank you, Bill. And we do have several questions. One individual was interested to learn more about crisis management, and I think if I'm accurate in interpreting that, you're talking about the risk reduction possibly that I was referencing, and what accreditation really helps you do, I think, is to identify upfront, within your department, what can go wrong. So you try to identify what the potential things that could go wrong are. Where are your vulnerable touch points? And we also, I should also say that care continuum that we had on display, each organization might have its own, obviously, because you have different target countries that you might be focused on. You might be getting patients from country representatives or facilitators in different countries, might be government referrals or insurance referrals. So there are different avenues that patients come into. So we would ask that you really understand your care continuum and look at your vulnerable points. And that's where, what can go wrong? Where in this process might things go wrong? And then to kind of analyze, well, how often might they go wrong? Have they gone wrong, a lot? And also, what is the impact? So what's the consequence if something goes wrong? Is it a really, really big risk, or is it a small risk? And so you do your risk assessment, the implications of that, and you focus on, those things that have high consequence and might happen a lot, obviously. But we, when we talk about our standards, we really like to think that, these are best practice because of the experience of many who have been through it and are talking about the opportunity, to have an international best practice. And one might be, as I mentioned earlier, with respect to financial transparency, is to tell the patient, and it helps the patient and it helps the organization avoid any hard feelings if there is a complication, what the impact of that is for the patient, because there's likely to be a financial impact. And some organizations do not tell the patient that. And so obviously that's something that when they complain to the insurance company, their experience, they're dissatisfied. So that to me is a vulnerable point, and that's why the standard was written. So that, I hope that answers your question. If you have, further inquiries with respect to finding out more, I'm happy to refer you to some articles and some information about that. And then the next question, or BK or Bill, would you like to add to crisis management? If there's,
I think, Karen, you covered the most of the
okay.
critical part of the crisis management components.
The next question I thought was very, very accurate when it comes to medical travel. And it said, it looks like without external regulation like accreditation and other processes, health facilities on their own do not often see the need to collect patient experience data and integrate into the service provision. What can be done to get all to know how important this aspect of care is? And that really is an excellent, excellent question, and one that we have realized as our standards do require that organizations collect and try to segregate their patient satisfaction by medical travel. However, as we started surveying, we realized we haven't come up with one yet that is able to do that, where they have collected and segregated the medical travel patients. So for the first year of accreditation, we accept the patient satisfaction for the entire organization. However, organizations that have been accredited are realizing it is really important to understand, and Bill alluded to some examples where the patient experience was really impacted by things outside of the hospital. And so it is very important. And we do ask so we're giving organizations 3 years by their second survey, that they would start aggregating and segregating the medical travel patient experience, because we understand the impact that might have on an IT system, et cetera. So we want to have that phased in. But everyone understands the critical nature of this data. And one of the reasons GHA came about was, I think, to help bring more clarity with respect to some of the challenging issues around medical travel and try to build consensus with different stakeholder groups on the needs for things, not to solve it, but just to raise awareness of some of the challenges and how we might go about resolving it. And that is certainly, that was an astute question that was asked. Are there any other questions or comments?
Thanks, Karen. I think I'll just put up a comment. As I mentioned in my introduction, that here in India, Government of India at the moment is organizing a month-long series of webinars called Udyog Manthan. It's like doing a brainstorming about industry. So they have chosen different, almost all industries which are maybe existing, which has a relevance of quality and productivity. So and that's medical travel, medical value travel is one of the important component of Udyog Manthan here in Government of India. So there were a lot of questions and things raised in that webinar, and that's why I was mentioning in there that until unless we have a point-to-point covering of the program, which encompasses starting from the person's home to the medical facility for clinical care, then if he need to stay post-op for some time, then that facility, the residence where he is staying, quality of that, the facility there, and then follow up, and then going back, the travel arrangements. So all those components need to be strengthened if we are looking at a very good medical value travel program. It is not worth exploring in fragments like there is accreditation existing in India for 16 years, NABH and JCI, QAI, and many others keep coming. And then there are medical value facilitators. We had some facilitator certification program, but there is no program which can connect all of these, So they work in isolation and they are not responsible for each other's activity. So if patient comes to get a treatment in a hospital, everything went well, and then staying somewhere, they are not connected. And that's why the complaints keep coming. So I think now the Government of India has been very proactive in that, taking this topic for Udyog Manthan in discussing and how we can, and that's why I gave an example of our collaborative effort of bringing on joint accreditation program, which connects all dots.
Yes.
Travel, hospitality, and treatment, every component and experience in relation to the, it covers all the components of the entire care continuum of medical traveler. So that's how it need to be built on. And I think we are really pleased that we could kickstart this today. And definitely we look forward some exciting journey together here. Thank you so much.
Well, thank you. And we look forward to that journey as well. And we appreciate the participation and the patience of the participants today. We will be, we have recorded this session, so we will have it available on both websites. We will make it available to the Quality and Accreditation Institute as well. And please, if you, there was also an inquiry about sharing our standards. We do have a, we would be happy to share, we have a subset of the standards that I think we could send out to the participants. So we would be happy to do that. It's called the Standards Brief. And we also have a lot of information available on our website. And or if you have a specific question, please send it to info@ghaccreditation.com. Again, we appreciate QAI. We're very excited about the excellent clinical surveyors who will be joining the team, and we look forward to a very successful partnership. So thank you.
Thank you, everyone.
Thank you very much.
Okay, thanks.
Okay, have a good evening, good day.
Have a good evening.
Good day, everyone.